Depression Psychopharmacology, Maxine Houston, Week 4. Neurotransmitter theory of depression. The major neurotransmitters in major depressive disorder include dopamine, serotonin, norepinephrine. Dopamine has a role in controlling the way reality is perceived. Lower levels of dopamine cause people to perceive a sense of pleasure differently. Serotonin is responsible for functions such as inhibiting pain, regulating mood, appetite, and sleep. Reduced transmission of serotonin contributes to depression and may cause suicide. Reduced serotonin may contribute to low levels of norepinephrine. Norepinephrine raises blood pressure because it constricts blood vessels. It triggers anxiety. However, in some cases, it helps depressed people determine reward and motivation. Effects of the drugs used on the neurotransmitter systems. Antidepressants are used to treat the disorder. Selective serotonin reuptake inhibitors, SSRI. They selectively block serotonin from being reabsorbed to increase its concentration in brain synapses. Serotonin norepinephrine reuptake inhibitors, SNRI, are used to specific patients that fail to respond to standard antidepressants. They inhibit the reuptake of norepinephrine and serotonin. Monoamine oxidase inhibitors, MAOIs, they are for inhibiting monoamine oxidase to increase serotonin and norepinephrine. Tricyclic antidepressants, they function as inhibitors that restrict the absorption of norepinephrine and serotonin in the synaptic cleft. The risks and benefits of using the most common medications versus not using any drugs at all. Risks: antidepressants have been recorded to have contributed to agitation, hostility in teens, and suicidal thoughts in adults. About 30% of patients have demonstrated moderate to severe actions. SSRI antidepressants pose risk to pregnancy, premature delivery, risk to breastfeeding mothers. Only sertraline and paroxetine are preferably safe not to contribute to significant levels in breast milk. Benefits: reduce symptoms of depression that include influence suicidal thoughts, reduce the occurrence of anxious symptoms, a solution to sleep disturbances. They increase the patient's focus, they improve the patient's mood, they improve the patient's appetite. Rate of success for the drugs and the incidence of side effects and mortality. About 50% of the people taking these drugs for the first time end up switching to another type of drug. These drugs contribute to residual symptoms that are not treated with the prescribed drug. For instance, residual symptoms left after treatment of serotonin agents may be resolved with drugs that increase dopamine and norepinephrine. Leads to severe and adverse effects such as weight gain, sexual problems, discontinuation effects, and negative emotional effects have been observed. Mortality. Use of antidepressant lower mortality as compared to situations where they are not applied. According to Zivan et al., no observable mortality differences in 1 year for the patient treated in 90 days. At 35% in the mortality rate was observed when administering antidepressant drugs for patients with comorbid diabetes. The use of antidepressants has not been linked with excess harm, even when accounting demographic and clinical characteristics. Thank you for reviewing my report. I appreciate you taking the time out to listen. Have a great day.